Good evening, everyone. I would like to start the work session for the Springfield City Council with roll call.
Mayor Van Gordon. Councillor Weber.
Here.
Moe.
Here.
Broadley. Here. Blackwell. Here. Doyle.
Here.
And Pictionary.
Here, and Mayor Van Gordon's excused. First item, please.
First item is the Eugene Springfield Fire Update. Chief Caven is here for this item.
Good evening, Council. Mike Caven, Fire Chief, Eugene Springfield Fire. I'm happy to be before you guys tonight and provide just a brief update of kind of all the things that we've had going on here at ESF over the last year or so. And hopefully leave some time to answer some questions. I apologize, I have to run out right at 7 o'clock to get my boy to a medical appointment. But so without further ado, let's see if I get this right. Perfect. So one of the things we've been talking a lot about, you've seen in the news and in discussions with legislative concept, is the impact of the closure of the University District Hospital and the ongoing issue with APOT times, or ambulance patient offload times. You sometimes hear us refer to that as wall time. It's the amount of time our ambulances spend waiting to offload a patient at the hospital. As you see in the statistics, in July, we implemented a fee ordinance in both Eugene and Springfield to charge for time in excess of 30 minutes waiting to offload our patients. We issued our first quarterly bill in October of 2023 to the tune of $336,000 between the three hospitals. And as we closed out the year with the second quarter, that bill was $337,000. We haven't seen any of that come through yet. The hospital is still kind of evaluating their options, their tools, which we expected. Throughout this time, despite expected increase in wall times, both hospital systems have remained engaged with ESF and other stakeholders in tools and methodologies to limit that time. And we're also implementing some policies to address our ability to leave a patient in the care of the facility and get back to service in the street. University Hospital closures, it closed on December 1st. During that time, we added ambulance capacity, and then also, which is just one unit a day. And then for the month of December, we added a squad or a two-person pickup truck type vehicle to answer calls in the downtown core of Eugene, expecting that people might look for alternative means or alternative ways to access care. We saw that unit run about 225 calls in the system during that time frame, but the overall saturation in the system, we didn't see warrant extending that unit beyond that time period until we can discover other resources. Across the system in December, as you can see, total call volume dropped about 9% year over year. But then climbed 5% year over year in that core, which is what we expect. And so we continue to track the trends on that as an outcome from the hospital closure. We've got legislative support with a bill spearheaded by Representative Nancy Nathanson from Eugene. She pulled together some stakeholders from the local hospitals, the county, the university, basically those impacted by the closure, and brainstormed some options for what might we fund. So for Eugene Springfield Fire, there'd be 2 years of funding for a peak hour basic life support ambulance to help mitigate the movement of patients, and then investment in an innovation fund. How that's being kind of laid out is a fund that will go to Lane County as a way for EMS, local primary care providers, the emergency rooms, to come together and provide some solutions that get people better access to care during more expanded hours, same day type care. But important to us is also 911 and emergency room diversion programs. We brought global medical readiness back in the fall of 2023 to give a presentation on a system called nurse navigation. That system is designed basically to be a tool for the 911 center to take a call, triage the patient like they do. If it's not a life-threatening emergency, they're able to send that call to a call center that's staffed with an RN and then LPNs who have come to our area. They spend 3 months out here learning all the different tools that we have, that the community has for access to care for things that don't belong in the emergency room or don't belong in an ambulance, and really get people to the right place. One of the interesting things for us and what we see is people utilize EMS when they don't have another way to get to the hospital or an urgent care or those solutions. A contract, should this be one of the outcomes with global medical readiness, is they have a ride source program contract built in. And so if you need a ride to the clinic, a ride to urgent care, or the emergency room that doesn't require an ambulance, you can get it to and from. And so that being said, the other option that we looked for in that innovation fund's a community response unit. It's that 2-person unit that responds to low-level EMS calls, so we don't have to roll a fire truck to things that don't need a quick response or all that staffing in there. I did add the Measure 110 impact to the legislative side just as an indication. We rounded out the year in 2023, averaging well over 100 overdose responses per month and averaging over 35 deaths per month. And I gave this presentation in Eugene, I think last month, and kind of described it like this. The overdose epidemic in our area is, imagine any one of the commuter planes that comes in and out of the Eugene airport crashing. And all 100 people on board are injured, all 150 people on board are injured some months, but at least 35 people die every single month. That would leave an indelible mark on our communities. And so, as we think about the impact of this overdose crisis on our community, it's like a plane crashes every single month. And so I appreciate the work that council's done here in Springfield to advocate for some revisions to that so that, we're not experiencing and watching our community experience such an impact to residents. So alternative response planning. We're going to talk about that legislative support or the innovation fund and how we imagine it. Dispatch triage and call, like I said, if there's a life threat, it's going to get an emergency response. It's what we're built for. And what our system has become overwhelmed with is everything below that line, the blue and green levels. And so addressing if there's no immediate threat to life, can we refer to a nurse phone line? Can we refer to urgent care, Cahoots, other street outreach programs? Are they experiencing an issue where they need to access the 988 system, which is still working through some challenges to get up to what was originally imagined? And then again, the ability for us to imagine what other resource needs there are. When we go back to the conversations with Rep. Nathanson and Peace Health and the county, we've thought about the idea of what's it look like to put an advanced provider unit in the street, meaning a paramedic paired with a nurse practitioner or physician's assistant who can treat you where you are, bill in that way, which we've seen just in the last few months, Medicare add a billing code like a clinic, but for the street, for people that don't have an address, which will be big in fostering these systematic changes. So we have an alternative response planning position that was funded in the city of Eugene last year that will help bolster our ability to plan for this and bring proposals forward of how we might deploy in the future that sustains the critical time-dependent resources for what they're needed for. Quick governance update. For Councilor Moe and Rodley on the governance review panel, they know that that's ramping back up. I think we have our next meeting on the 22nd of February, and then we'll be back to see the council for an update with our contractor on March 4th. And so we're really excited to see that start to come to fruition and all the stakeholder input that has been given along the way from this council and other employees within the city about what the need is and what the options are and what it means for the future of ESF. As you recall, this process, I mean, it began way back in 2010, but this latest iteration of governance review began in 2022. We had some bumps along the way with, right vendor or not to lead through that. We've got a great vendor that was hired in the fall of 2023, AP Triton, a lot of subject matter experts on there. And I think you all will be pleased to hear what they have to say and, how they took everybody's input on what our future needed to be to fit within both of our communities' expectations and the needs of the councils and everybody in between. And so, again, we'll tune into the governance review meeting on the 22nd, but we'll be here in person with the full council on March 4th. EMS redesign, we talked to you all a little bit about this when we initiated it in early 2023. The concept as a whole is taking our historical ambulance staffing model of utilizing cross-trained firefighter paramedics to staff all of our ambulances and look into a method where we're able to leverage our single role BLS program into a program where people could enter a career within the fire department as a single role EMT or a single role paramedic. What it does for us in the fire department is it really opens up the recruiting pool to a much larger population. We were hearing as we're trying to figure out how to bolster our numbers in recruitment that half of the people entering paramedic programs didn't want to be firefighters. And we were letting those people leave our communities after they got their training when we absolutely had very important work for them to do. And so we embarked on the beginning to build out part of our system. It may become our entire system in the future that utilizes these cross-train or these single role EMTs and single role paramedics in place of the cross-trained firefighter paramedics. We've transitioned 2 of the 4 initial planned out of our 7 total 24-hour ambulances. The third one will go into service on March 1st at Station 4 at 5th and Centennial. And so most of the time it's already staffed with these folks while they're getting their field training time with more experienced firefighter paramedics. That's been our challenge in the transition, is making sure that we're putting people out there who've got good training, got solid background in the system, and they're doing amazing. They're well respected by the crews. They're performing well. It definitely increased our recruiting numbers and our ability to fill the first couple of academies. Our last one, we were only able to net 1 paramedic. It's not an indication of our own department. It's an indication of an issue statewide with the lack of available paramedics. And so we're working on some tools that I'll touch on here in a moment with who all we're recruiting, where we're assigning them, so that we can leverage the limited amount of paramedics the best we can. We were able to add so that these positions don't cost as much as cross-training somebody. And so in places where we would look to add capacity in the system or ask for funding to do so, or add the 24-hour supervisory component, we were able to leverage those savings to pay for those investments early on in the program, which has been very helpful, especially with the wall times, the APOT times, and just the growing need and demand for somebody to be focused on EMS in the system. As far as ESF, our staffing, our goals in 2024, we continue to be challenged with staffing. We had 8 retirements at the end of 2023, which some great employees, some storied employees, but it left us a bit short. And when you imagine our last paramedic recruitment only getting 1, that leaves us a little short as we enter the year. However, I'm excited to announce at 5:00 today, our most recent firefighter recruitment closed with 270 applicants. We haven't exceeded, between 30 to 50 applicants in more than a decade. Now there's a key to that recipe. We took a hard look on what our minimum standards were for the job or our minimum entry requirement. as we make our moves with the EMS redesign, it allows us to free up the number of paramedics that we need for fire assets. And so we opened up to firefighter, EMT, basic, intermediate, or paramedic. And what we saw is exponential growth in our pool of applicants. What we've seen in kind of some initial views, we don't see a whole lot of information in the front phase, but a lot of veterans, a much greater proportion of minority candidates than we're used to seeing. And so we're really excited to see what the outcome of this, because it lowers the entry requirement. Instead of committing to get a degree to start a career here at ESF, you can become an EMT, get hired on our single role program, our BLS program, and now even as a firefighter. And so we're really excited that we'll be able to bolster our ranks and not struggle to fill them, because we're always looking for the most advanced position across the board. 2024 goals for ESF, wildfire planning and fuels mitigation is a big one. And so we're having some conversations as we prepare for FY25. We secured funding from the payroll tax in Eugene, or the community safety payroll tax, that's funding a manager for the program. That person has been appointed and has a pretty decent materials and services budget to build up our education and outreach programs. We're working with the Western Fire Chiefs innovation and development manager around this space as we do our outreach and learn to do it in a way that gets to the community more effectively. We're kind of a blank slate for them and offering up, let's use whatever innovative tools you have and grant funding to have a really great wildfire program when we're done. So department embarked one of our goals that we set at the end of 2023 was kind of reviewing all of our plans, our standards of cover, how we do our work, how we show up, how we respond, our strategic plan, then our vision, mission, and goals, and making sure that they reflect who we are today, our changing environment. We've changed our workforce. And so we look forward to updating those plans. It's good timing with the governance discussions going on. And we're looking to leverage technology. We've got a couple different technology platforms coming our way that will help us be more interconnected with our rural partners. That's going to be important when it comes to stopping fires that start just on the outside fringes of our communities, but also working together in bigger disaster response. And then the next one, we purchased a program that will help us really identify with science and predictive modeling with a decade's worth of response data, where and how we staff, so that when we come and address, and most importantly, our elected bodies, we have a conversation about how we're staffing units, where we're recommending putting a new unit. You can see in real time the impact to the system, unit reliability, response times, all of those metrics. You can ask questions and we can make changes right here, and you see what the impact is. There will really help us plan not only today, but far out into the future. And just a quick 2023 year in review. So we ran a lot of calls, as you can tell, almost 50,000. It's the first year we capped more than 100,000 individual unit responses. Of those, we had 260 building fires and 1,200, or a little over 1,200 fires that include bark dust, wildfires, dumpster fires, many other fires, 756 cardiac arrests. We transported over 23,000 people. And so we're busy. Our crews do an amazing job covering these calls. A lot of days we're out of resources, more often out of ambulances than we are out of fire trucks, but both do happen. And one note that's not here, when we look at from 2015 to today, our call volumes increased 35%. And so where that perspective lands is, we took some moves in 2023 to evaluate the types of calls that we're going to and whether we needed to go or there's other resources to send. And so what you see is we've been relatively flat over 2022 to 2023. And that's because we looked at calls that didn't end up having a disposition or We're checking smoke when there's a large wildfire in the area and there's, only a single caller. All of those things combined held our call volume relatively flat, 88 calls, increase year over year when we're used to seeing, 3 to 5,000 call increase year over year. That's where we're leveraging data and input from our crews that are going on these calls. And then as we move forward, back to the alternative response planning is leveraging more of that data, being data informed in our decision making of how we respond, how many people, how many units, or whether or not there's some other service that should be responding to some of these calls. And so there's a lot of space to think about that into the future. We know as public budgets get a little tighter for everybody, that we have to be more nimble and thinking of new and innovative ways to meet the public's demand for service. This is a question time.
Counselor Mo, go ahead.
Thank you, Chief. When I was interviewed a few weeks ago on the merger team, I just had a copy of the annual that you put out each year services. And I went in there and it says, what do you think the fire department's for? And I says, you're in the medical transport business. Yeah. And the numbers here, these things don't work, remember? There's 23,000 ambulance calls, 5% of them of those calls, or there's 5% for fire. And a fire truck goes out with many of those ambulance calls. So how can we change that? You're already working on that. I see the innovative thinking that you're doing right now. I encourage that. I want you to do that. In Australia, years ago, I was in Sydney. I heard a siren going by, and it was EMT on a motorcycle. First one to arrive. Wow, how was, and they use city buses for school buses during school hours. Innovative. We need to be thinking more creative like that. And you're doing that. I like that. So, and I would look at other countries, how they do it. Just see what's going on. And we got the best fire department in the world. I know that, but I want to make this better. And we're also talking about budgets. We're limited too, and we're already looking at how can we do the same thing with less, and that's gonna hit us. Thank you.
Yeah.
Beth, go ahead.
Chief, thank you. I really appreciate your presentation. That was a lot of great information, and considering the challenges you have, I think you're doing a ton of fabulous things with the department, and the going away from the dual role being one of them. I think that's just something that I've always wondered why ESF has done that for so long. Just opening that up to having EMT basics. I think that's really smart. And I'm glad to see that happening. I have a question with the time on the call increasing 17%. Is that directly related to the wall?
Yeah.
Is that
Yep. That's the time to clear for our ambulances driving that.
okay? That's what it was.
Yeah.
Thank you.
Anyone else? A quick comment. You mentioned there, I really appreciate your presentation. It's very clear, very concise, and very informative. Much appreciated. Well done.
Thank you.
And I definitely like Councilor Moe mentioned, expanding your horizon, so to speak, and looking at for how else can we increase in the interest in signing on board at a lower cost for us. And I think that's fantastic. Keep going. My support there for sure. You did, you mentioned on a slide, on slide 8 or page 8 of your attachment, under staffing and goals for 2024, I saw that what stuck out in my head just from recent history here, where it says wildfire planning and fuels mitigation. I'm really concerned about the 16,000 trees that was broken this last ice storm, and that the city is taking some huge steps. I mean, it's a very successful program in collecting debris for the citizens, et cetera, and it's huge. I'm very concerned though about the many lots and yards that the folks either didn't have the money to pick up or didn't get a chance or just haven't, rental lots, whatever. I'm really concerned about the amount of fuels, that are going to be sitting on these lots. I know that El Rapa and the city went through and asked El Rapa for expanding the backyard burning, but it was basically just expanded by an early start and allowing for greenwoods. But my concern too is that, is that enough? And do you think that based on the amount of fuels on the ground now are going to cause some significant problems or potentially cause some significant problems? And if there's a plan to maybe mitigate that prior to that happening?
Great question. It's a concern we share. I've been gone at a development institute in Virginia over the last week, but one of the last conversations we had ET talking about the cleanup efforts or any federal relief was just passing the idea of what does it look like to get federal funding to help clear those out. We don't yet know if that's possible, but that's one of the conversations had is providing that as a tool for sure. It looked like Nancy.
City
maybe had
Manager
something.
Newton, do you have something?
That is a topic that we're looking at as part of our overall budget deliberations. So, we have some proposals that have come before us, but we're looking at getting a little bit more information. So Chief, I did receive your, proposals. So I'll be following up with you on that shortly. One quick thing, I don't want to go totally off topic, but I did want the chief to tell a little bit about what you were doing last week and why that's important and why that I'm just so proud of you. So I just wanted to give a little airtime.
Yeah, so I participated in a program. It's called the Fire Service Executive Development Institute. It's a year-long cohort with 25 other chief officers from large departments across the country. And so we spent the week together in Virginia. I think our first class was Saturday night when we arrived, and it was 8 a.m. till 8:30 p.m. All the way through midday Friday. It was a great opportunity. As they put it, there's all these education things that we can get as firefighters, become fire chiefs, but no real program that teaches you how to do it. And so it's a facilitated program from some of the best chiefs in the country, and we're going to be together 4 times throughout the year, studying, kind of talking about our shared issues. It's a very diverse group of leaders in the fire service. It's pretty cool. There's about 250 applicants, and was fortunate to be in the top 25. And it's a program funded by a grant through Motorola. We're the 12th cohort that they've funded, which is it's pretty awesome. I can tell you from being there, when you think about the future, what you can do in this job, it will be very, very helpful for me.
Well, that's good to hear. So looking forward to hearing something in regards to the mitigation of the excess fuels in our city.
Yeah. That conversation is ongoing beyond just the budget discussions on a program that we might establish, but what other tools are out there, grants are out there to help us make resources available for those that can't clear their lots, especially in those high risk areas.
Yeah.
Councilor Doyle and I toured Jasper Meadows the end of January, I think. Yeah. And so we're looking, we're making sure that we can put some plans in place.
Excellent. Appreciate it.
All right.
If there's no other questions, next item in 2 minutes.
No
Thank
other
you,
items.
Chief. Go get your kid. No more items? Okay, well, I will adjourn the work session and we'll be opening up the CETA session in 2 minutes.